Aaron Blake is a political reporter for The Washington Post, and he joins us live. So, okay, Aaron, why does Paul Ryan have so much confidence in Mitch McConnell's ability to get this over the finish line?
Well, I think it's the track record. Mitch McConnell has shown to himself to be a very capable leader of Republicans in the Senate. There are myriad examples of things that looked very difficult to pass and wound up getting there. I would say in this particular case, you have to wonder if the numbers are just a little bit too tough. A 52-seat majority, 6 senators, like you said, not on board with this right now. 5 of them, by the way, not even ready to go to the amendment process, is a very tough calculus to make. So how they're going to get from where they're at right now, which is maybe 45 or 46 votes, up to 50, just looks like a very difficult path, especially this week, which is what their intention was in the first place.
Not a lot of wiggle room there for Leader McConnell. But let's talk about some of the problems that some of these Republicans have with the bill in its current form, because you have the conservatives who have one set of problems with it, and then you have moderate Republicans who have an entirely different set of problems with it. How does it break down?
Well, basically, the conservatives would like a more wholesale repeal of Obamacare, which this is not. This is basically a health care reform bill that keeps much of the subsidies and the general kind of flavor of Obamacare intact while kind of scaling it back a little bit. So you got members like Rand Paul saying, I thought we were repealing Obamacare. What is this bill? On the other side, you have basically a lot of concern about rolling back the Medicaid expansion. Senators in states like West Virginia, where Shelley Moore Capito is concerned about this and is withholding her support, they're worried about what this is going to do now that the Medicaid expansion has begun in their states, and in states like hers has been used by hundreds of thousands of people. What happens when you take away that government benefit that's already been bestowed? So squaring both of those sides, trying to get the conservatives on board along with those concerned about the Medicaid expansion is something that the Senate is going to have to try and do. And by the way, I would add the House had a similar situation where the moderates and conservatives were upset with this. They wound up going more in the conservative direction and getting the bill passed. I'm not sure the same game plan would work in the Senate just because the margins are so small here.
I think a lot of people might be a bit confused to listen to Democrats who, of course, have all promised to come out and vote against this. Republicans are not anticipating any support from the other side of the aisle, but they are saying, come and work with us. Republicans saying, we would love to get input from the Democrats, but they're not offering any. At the same time, you have Democrats saying that they have been shut out of the process. Where is the truth? Is it sort of somewhere in the middle there?
Well, I think that the two sides would love kind of the ideal of working together, but I think when you're talking about basically any cuts to that Medicaid expansion, that makes this a total non-starter for Democrats. They're not going to sign on to anything like that. When you talk about moving this bill to the right, potentially, that's certainly going to turn them off. So I don't know that it's necessarily a situation where the two sides just refuse to work together. I think it's a situation where Republicans are trying to definitely move this in a slightly more conservative direction. Democrats are not on board with what they're doing with the Medicaid expansion, and that just makes any kind of bipartisanship impossible at this point. So there is a possibility that could eventually happen if this current bill fails. They maybe do some smaller things around the edges with Obamacare. But at least for now, this is just not something that's logically or feasibly going to win any Democratic support the way it's been crafted.
All right, so at least not right now. We'll keep our eye on that. I want to ask you about the president's travel ban, because we heard yesterday from the Supreme Court that parts of it will be allowed to go into effect before they take up arguments and hear the entire case later in the fall. You wrote, if this is what passes for a big Trump win, it's going to be a long 4 years from him. What do you mean by that?
Well, look, this was a step in the right direction, certainly, for the White House. They got a travel ban that had been halted by the lower courts, at least partially reinstated on a temporary basis. That's better than the alternative of the Supreme Court upholding those blocks of this travel ban. But this is something that is still very much up in the air. The ban is still intact for people who have what's called a bona fide relationship to someone or something in the United States. We don't know what's ultimately going to happen with this, and so I just think that clearing a bar of, oh, maybe this is actually constitutional for the president to have done this is a very low bar for the White House to clear. Indeed, it would have been shocking if they would have done something right away that wouldn't have cleared that bar. So we'll see what ultimately happens with this. But the fact that the president is basically maybe going to be able to move forward with his executive order, I don't think is something that we should be hailing as a major victory for his agenda. It's just not quite there.
Aaron, the initial travel ban, the initial executive order, asked for a 90-day period so that the vetting process could be improved upon. We could get things up and running in a more effective way to make sure that people who want to harm us are not being let into this country. It has now been about 150 some odd days since that initial executive order was issued, way more than that 90-day period of review. Do we have any sense of what has been done during the ensuing time to perhaps get that vetting system up and running?
Well, we haven't seen it yet. We haven't seen the results of whatever effort may be underway in that regard. So that's another point that I think kind of suggests that this maybe isn't such a big victory for the White House as they'd like it to be. The other thing, by the way, is that, you mentioned the first version of this ban that was introduced in January. They came back with another version in March after that one was struck down. This is the Supreme Court saying maybe number 2 is okay. The first one, by the way, is the one that Trump said that he really wanted. He even tweeted a couple weeks ago that the second version was watered down and politically correct. So again, the fact that the idea that this kind of consolation prize executive order that Trump insists wasn't even his first choice, is now being potentially resurrected by the Supreme Court, allowed to go forward. I don't think that's a huge victory for the Trump agenda necessarily.
Before we say goodbye, Aaron, I want to ask you about Syria. We were talking with David Martin just a few moments ago about the red line that the administration put out last night in that late-night letter talking about real problems for the Bashar al-Assad regime if they continue to go ahead with what looks like preparations for another chemical attack on Syrian people. What are the political ramifications of the White House having issued that warning, that stark warning last night?
Well, I think it was surprising to a lot of members. You might have seen comments from Lindsey Graham basically asking kind of how much thought had gone into this new red line policy when it comes to Syria. There are indications that CENTCOM wasn't particularly clued into the fact that this message was going to be put out there. The White House now disputes that in an anonymous statement. The last Syria strikes were met with pretty bipartisan approval. I imagine a more limited approach this time would probably pass muster in the court of public opinion and with members of Congress. But if there's one other thing that we're seeing in these polls, it's that a more prolonged, more involved role in the Syria civil war is not something that the American people want. So to the extent that this could be a precursor to a more involved effort in that country, that's something that the president is going to find some hesitance for both in Congress and with the American people.
Aaron Blake, I enjoy reading your work in the Washington Post. It's good to talk to you today. Thanks for your time.
Thank you.